Bueno, pues buenos días, ya casi tardes, a todas y a todos de nuevo. Continuamos en este seminario doctoral de estudios europeos del Premio Europeo Carlos V a Angela Merkel, la fortuna de estar unidos, garantizar y fortalecer la cohesión de Europa. Y a continuación daré la palabra a JÜRGEN ELVERT, Cátedra Monnet de Historia Europea de la Universidad de Colonia. Ya ha sido presentado anteriormente, habéis tenido la oportunidad de escucharle en la ponencia, en la sesión inaugural. Simplemente por nuestra parte, como Fundación Yuste, agradecer el constante apoyo del profesor JÜRGEN desde el inicio de estos seminarios doctorales ligados al Premio Europeo Carlos V. De ellos, del profesor Yves Boussier, de Michel Dumoulin, de Sylvain Sirman, surgió esa idea de dotar al Premio Europeo Carlos V de este contenido que enriquece enormemente lo que es un galardón que, más allá de lo que es lo ceremonioso, puede tener un efecto real y efectivo en lo que es la aproximación de los temas europeos a la juventud, no solamente europea, sino de diferentes países, tanto de América Latina y del resto del mundo. Profesor ELVERT, le dejo encargado de presentar a Kye Gan, y también agradecer al profesor, al doctor Kye Gan, el estar aquí con nosotros, y le damos la enhorabuena también por haber sido beneficiado de esta beca. Profesor ELVERT.
Yeah, thank you, Miguel, for this very friendly introduction. It's quite easy. You all know our next speaker, so it's just a formal way to announce our next speaker, Kye Gan, who came all the way from Malaysia via Oviedo to Yuste to talk about public health preparedness for the next pandemic, I hope not, behavioral and psychological resilience among healthcare workers in the European Cohort. Ricky, it's all yours.
Testing. Good afternoon, everyone. Thank you, Professor ELVERT, for the introductions. And I'm extremely humbled and honored to be given this opportunity to present to all of you my doctoral thesis. I'm currently completed my second year PhD in Universidad de Oviedo with the supervisor, Professor Adonina Tardon and Professor Pedro Arcos. And our project is working on the European project Orchestra, which is connecting European Cohort to increase common and effective response to COVID-19 pandemic. A little bit of disclosure, I have no conflicts of interest to declare, and this study has been received ethical approval from the Universidad de Oviedo Research Ethics in full accordance with the Helsinki Declaration, and this project was sponsored by the Horizon 2020. Well, today we will walk together down the memory lane of COVID-19 pandemic. I will define my research gap as well as research question. We will go through my research methodology and the result that I have obtained so far, including the quantitative studies, systematic review and meta-analysis on preventive behavior, proof of concept of artificial intelligence applications of psychological first aid application, and the future direction on the qualitative studies, which I am planning to move forward with this awards grant. So let's walk down the memory lanes of COVID-19 pandemic. At the end of 2019, the World Health Organization was informed that there is a pneumonia of unknown origin outbreak in Wuhan, China. And until January of 2020, this outbreak has been spread all over Asia. And February 21, 2020, COVID cases has increased within the European Union, notably in the northern part of Italy. And at the same time, March 11, World Health Organization has declared a global pandemic for COVID-19. Well, at that time, I was in the last year of my medical medical officer residency in emergency department in Malaysia. I am fully prepared with 5 years of medical studies and 4 years of training. Me and my colleague have high motivations of, to help the healthcare system to tackle the pandemic. I still remember vividly first time wearing the PPE, personal protective equipment. I feel like an astronaut. But little did I know that later on, we sweat in this PPE, soaked with our sweat and tears. As the case of COVID-19 increased, there's so much burden on the shoulder of healthcare workers. We've seen our patient dying. We've seen our colleagues infected with the disease, bringing this disease back to their families. We receive so much stigma from our communities and neighbors because they're afraid that we are the source of the infections to the community. But at that time, we have so little support from the mental health perspective. It's almost very limited, and with all those ongoing stigma. And it is not only my personal experience, but it is also a global phenomenon. As we look into the timelines of the COVID-19 response in EU, the first mention of the mental health was in May 19, 2020, when the EU youth members discussed about the impacts of COVID among young people. And in August 14, 2020, the research in CDC US found 41% of the responders reported with struggling of mental health, with 11% have the idea of suicide. And they found that essential workers, such as healthcare workers, were at higher risk. In October 24, 2020, Mental Health Coalition was established by World Health Organization with a renewed focus on mental health. It is a really good move, but personally, it is 10 months late. In February 23, 2021, World Health Organization expert group on mental health had their first meeting. And by that time, December of 21, EU has already approved for COVID-19 vaccination authorization. And at that time, they also recognized that healthcare workers are the vulnerable group from the perspective of mental health. In October 7, in CDC, mental health conditions were added into the list of risk factors associated with a severe illness from COVID-19. Well, let me make this, simplify this situation of vulnerabilities. The healthcare workers, we working hand in hand with the COVID-19 patient, has higher risk to get exposed to COVID-19. And then it is now understood that healthcare workers are really vulnerable to the mental health condition. And then the new findings finds that the people who are suffering from mental health condition are at a higher risk to get the severe form of COVID-19. Did you see the severe, dire situation that the healthcare workers all around the world are facing? As for me, after complete my services, I continue my studies in Erasmus Mundus Master in Public Health and Disaster in Universidad de Oviedo in Spain, and later on in Karolinska Institute, where I started to explore more in the mental health perspective in public health. And I realized that there's a huge gap in this mental health preparedness, which motivate me to move on forward in my PhD research. Moving forward down the memory lane, more research now coming out showing that 52% of the healthcare workers all around the world from this global meta-analysis have burnout syndrome. Imagine 1 out of 2 healthcare workers in the hospital. Further studies also show that 30% of the healthcare workers have anxiety, 28% depression, post-traumatic stress disorder 20%. And by then, World Health Organization in May of 5th, 2023 announced that there's an end of pandemic. But we are still experiencing the impact of this pandemic, especially from the mental health. As we can see that, as we can see that almost 30% of the healthcare workers are planning to leave their current job, and 1/5 of the healthcare workers want to quit their profession completely. All right. So what is the state of COVID-19 now? What is the status? World Health Organization has classified COVID-19 as disease X, which among a list of pathogens that could cause the future outbreaks and pandemic. And this is so important because of we need to communicate the risk to do the proper surveillance from the perspective of public health and to make sure that they are in control. And with this recent publication, you can see that in the European context, the COVID-19 is still there, together with the high pathogenic avian influenza, gripe, still waiting for the right mutations, right time to strike for another outbreaks and pandemic again. And I think it is also important to define what are the consequences of a COVID infection, which is long COVID. It is defined as the continuations and development of a new symptom after the initial COVID infection, and the symptom lasts at least 2 months with no other explanation, up to 5 years. Well, we only have 5 years of data after COVID-19 pandemic when COVID-19 first appeared. And this long COVID situation has a long list of symptoms, up to 200. But the most common one was fatigue, brain fog, some of the respiratory symptoms, loss of sense of smell. And a lot of studies have started to appear to show the biological and physiological mechanism behind this situation. For example, the virus reservoir. For example, the virus. Sorry, I'm just trying to adapt to this technology. Virus reservoir, inflammation, some of the endothelial dysfunction, and even gut microbiome disturbance after the COVID-19 infection. However, there's a gap in these studies is that not much study has been done in terms of mental health, especially in the occupational health perspective. So here I want to define what is health. According to World Health Organization, health is the complete physical, mental, and social well-being, not merely absence of any disease or infirmity. It is a sweet spot between the overlap of these three big domains. Physical well-being, is a physiological aspect, biological aspect like your sleep, your nutrition, exercise. Social well-being focuses on quality of individual relationship, the interaction, the connection with your community, including occupational context. And mental well-being, which I focuses on, is a state that enable people to cope with the stress of life and realize their abilities, learn well, work well, and contribute back to the community. And unfortunately, mental health is one of the gaps that I plan to focus further in my PhD thesis. So the question for my PhD is, who are the vulnerable ones among healthcare workers? Vulnerability can be defined as the physical, social, and occupational factors which increase the susceptibilities of healthcare workers to psychological impact in COVID-19 pandemic. So we want to see among healthcare workers who are the one that is most vulnerable to this situation. Next, I also want to look into what are the psychological consequences, the potential mental health problem that may occur as a result of suffering of COVID-19 infection among healthcare workers. And lastly, I also want to look into the mental health resilience and preventive behaviors among healthcare workers. What are the factors that leads to mental health resilience? Resilience can be defined as the abilities of the community to absorb, adapt, transform, and recover from an impact or hazard. We oftentimes use bamboo as a representation of resilience on how they are able to manage with all the stresses. And then the preventive behavior, any behavior that according to professional, medical, and scientific standard that prevent disease in asymptomatic stage and which is voluntarily undertaken by a person who believes himself to be healthy. And this is really important that has been stressed during the pandemic among healthcare workers. So the method that I have been using is literature review and meta-analysis by using the PRISMA guideline. For the quantitative studies, we have used longitudinal studies of healthcare workers cohort in Spain, Romania, and Slovakia. We also did cross-sectional survey using translated and validated psychometric questionnaire that we developed, as well as the available one. And the next step that in my doctoral thesis is the qualitative part, which I plan to use with the support of this award. Okay, this is the result of one of our developments of the screening questionnaire. We have published this in the British Journal of Health Psychology on development, validation, and accuracy of orchestra emotional exhaustion screening questionnaire among healthcare workers during COVID-19 pandemic. So in this study, we do a comprehensive literature review to find out what are the common occupational psychological phenomena that has been seen among healthcare workers, and we try to develop the questionnaire. And we do the content validity among the experts in Romania, Spain, and Slovakia, and then we do a pilot study in Asturias to look for reliability, convergence, validity testing, and the most importantly, accuracy testing to see how this questionnaire can accurately screen the situation. So what we found from the studies is emotional exhaustion is the main causes before the occupational phenomenon could deteriorate into burnout, change fatigue, and compassion fatigue. Burnout is a syndrome conceptualized as resulting from chronic workplace stress, characterized by the feeling of being drained, ineffective, and cynical about one's work. Change fatigue, the stress that is perceived by the employees of an organization in a constantly changing status, which we've seen a lot in the COVID time, the policy from the national, from the organization, from the unit, department. And then lastly, the compassion fatigue, which is commonly seen in healthcare workers who takes on the suffering of the patient who have experienced extreme stress or trauma. For example, a patient who appeared to you and then have a huge suffering and unfortunately passed away, but that suffering due to empathy and compassion stay within you, that you carry on the burden, that is the compassion fatigue. And we found that emotional exhaustion is the dimension that is first appear before all these severe conditions arise, and is defined as the form of feelings and sensation of being physically and mentally exhausted by psychological effort made at work. So from these, we developed a questionnaire which we use to screen among all the healthcare workers to capture this situation before it developed into more harder to treat psychological consequences as mentioned previously. And these questions were meant to be really brief, really short and easy to understand so that we did not disturb the healthcare workers with their busy schedule. Next, this part, the data has not yet been published, so please do not share or post. Next, with this screening questionnaire, we further into the longitudinal analysis to look for longitudinal changes of emotional exhaustion and its associated social occupational factor among European healthcare workers during and after the COVID-19 pandemic. And these studies include 711 healthcare workers from Romania and Slovakia, and it's measured at 2 times, during and post-pandemic. And interestingly, we found that female healthcare workers, younger the age, and those who work directly with the patient, especially physician, has higher risk or higher vulnerability of developing emotional exhaustion. And this study is really aligned with a lot of study has been done in different regions such as US, and our data shows the European conditions of emotional exhaustion vulnerability. Next, we also look into the psychological effects of long COVID, another part of intersection of the circle that I have shown you just now, of the healthcare workers, mediated by effort-reward imbalance. Effort-reward imbalance is a theory that is proposed by Sigris, 2016, a German medical sociologist, who have found that a situation where there's a perceived mismatch between the effort of an employee's expend and the reward they receive will lead to potential stress and negative health outcome. And we found that the effort that the healthcare workers in European context has given is really high. For example, long COVID-related strain They themselves, having dual identity, they themselves suffer as a patient themselves and have to taking care of other patients. High workload, time pressure, responsibilities and overtime, interruptions and disturbance during work. And they also perceive that they have received a really low reward in terms of insufficient support of long COVID situation. Well, this situation is not well understood until 2021. Inadequate salaries or benefits, lack of esteem, low promotional prospect, and low job insecurity. And it is a cross-sectional study done in June to September 2023 in 3 countries, in Spain, Romania, and Slovakia. And among these, 691 healthcare workers with a previous COVID infection, 24% of them reported having long COVID. And 41% of these healthcare workers have high emotional exhaustion, and 49% of them have PTSD, post-traumatic stress disorder, and 31% of them have medium to high level of burnout. And really interestingly, that the mediation analysis has shows that there's a significant total effect of long COVID on emotional exhaustion, burnout, and PTSD. In other words, yes, long COVID can lead to emotional exhaustion, burnout, post-traumatic stress disorder, but this situation can be also explained through effort-reward imbalance at work. This will give the evidence-based opportunity to the policymakers, especially in organizational level, to look into this effort-reward imbalance in order to improve the conditions of the workers. Next, we also look into the mindfulness practice on how it affects occupational burnout, mood profile among healthcare workers in Asturias after 5 waves of COVID-19 pandemic. Asturias is the northern part of Spain. So, mindfulness is defined as awareness of one's internal states and surrounding, and we use 5-facet mindfulness questionnaire that measure observing how healthcare workers are able to observe their environment, describing their environment, acting with awareness, and most importantly, non-reactivity and non-judging. For example, if a frustrated patient comes and throws insult to the workers, will they react immediately by giving a reaction, negative reaction back, and judging to have the ideas of the negative connotation immediately, or will they take a step back and then to consider, to assess the surrounding? And this comes in line with the theory of mindfulness to meaning, whereby mindfulness is proposed to have the broadened perspective from the perspective of attention and sensation. And with this, one step behind, they were able to have a positive reappraisal as well as positive emotion and eventually form a meaning to the situation. So in the healthcare workers that practice mindfulness, they were able to think, well, maybe it's not personal, maybe the patient is suffering something really bad situation that require attention and hence the reaction. So, not surprising, the findings that overall mindfulness was highly significantly associated with lower negative mood state, including anxiety, depression, anger, and fatigue, and confusion. And further analysis also shows that increase in mindfulness reduce the likelihood of experiencing burnout and the feeling of ineffectiveness. And notably, the non-judging and non-reactivity domain emerge as the significant predictors to improve the mood outcome. And then we move a step further to do a systematic review and meta-analysis on the preventive behavior among EU healthcare workers pre- and post-COVID-19 vaccination availabilities. A total of 21 articles were included in this meta-analysis that include 33,000 healthcare workers in EU. Majority of the articles are coming from Spain, Italy, Greece, followed by Poland, Cyprus, Germany, Finland, and some have cross-European studies, countries such as Spain, Belgium, Greece, France, and Cyprus. And the findings are really interesting. The aim of these studies is to find which domains of the behavioral construct could lead to the adoption of the preventive measure practice, like wearing a glove, wearing a mask properly, taking a vaccination. And we found that knowledge have a positive prediction over preventive behavior, but positive attitude has twofold higher of positive predictors. So when we provide healthcare workers with up-to-date latest information, they will likely to have this preventive measure done. But if you enforce positive attitudes among the workers, for example, create a positive reinforcing environment, having the mentor support on how to correctly use the preventive behavior and measure, this behavior found to encourage the healthcare workers more to adopt the preventive measure. Next, the threat perception. If the healthcare workers have the perceived risk of the infection of COVID, and they perceive severity, if they get the infection, it will be severe, then they are 2 times more likely to have this preventive measure practice in their workplace. And we also find that this has to be done really carefully, because excessive threat perception will lead to fear, and fear will give the negative consequences again, like, for example, psychological consequences. And next, we also look at perceived benefit, which shows the largest effect for the adoption of preventive measure, tenfold. For example, if you receive COVID vaccination before infection, you will be less likely to have long COVID. What are the benefits after performing some of the preventive measure? Then they are more likely to adopt it. And then perceived barrier, for example, side effects of wearing glove, allergy, mask, eczema, and some of the misinformations that many of you guys are talking about have shown to have a negative impact on the preventive measures on the healthcare workers. And these findings is really interesting and important so that we can use the evidence-based scientific recommendations for the next pandemic preparedness guideline. Okay, so this is published, so you can share, of course. So we also look into the psychological first aid, proof of concept and comparative performance of ChatGPT, as well as Gemini in different disaster scenarios. As a public health disaster doctors, we know that mental health providers is a very limited resource. It is not only seen during the COVID-19 pandemic, but the recent conflicts in Ukraine, in Gaza, has shown that need assessment has shown that psychological first aid provider, mental health provider is always in the dire need. So we are looking into the possibilities of the AI to provide this psychological first aid. So psychological first aid is a method of providing initial support to individuals who are experiencing distress, particularly after the traumatic event or crisis. It is invented in the World War II. And it is a simple procedure of look, listen, and link. We train medical providers as well as the general public on how to provide psychological first aid to support people. And this is because there's a golden hour when someone faces trauma before they can develop into post-traumatic stress disorder, golden hours of 6 to 24 hours. So we have to have this psychological first aid to support them. And the aim of the study is to evaluate the performance of 2 AI chatbots, which is most commonly used. We use a mixed method of cross-sectional analysis. So we are using the scenario of the disaster, including pandemic, that we train the students as well as the general publics, and we put it as a prompt to ChatGPT. And we see how well the ChatGPT giving the response from the perspective of psychological first aid. We use the same marking questionnaire that we will rate our student. We do a quantitative analysis to see how well they answer, and qualitative analysis, including content analysis for AI hallucination and thematic analysis. So the result was really interesting. It is shown that ChatGPT have a better performance than Gemini. However, there are AI hallucinations seen 18% in ChatGPT and 50% staggeringly in Gemini. And in the field of healthcare, hallucination is a really dangerous situation. because it shows the credibilities, and it can be sometimes detrimental in this in the support that is provided. Therefore, we have a really reserved attitude now, or recommendations in using chatbots in providing psychological first aid. In our thematic analysis, it's really interesting because we see the AI chatbots able to assess the need and the state of the patient, able to listen them by providing empathetic response, and then able to link them with some of the help that is needed. Sometimes they all even show professionalism, for example, respect to the confidentiality, and they also able to provide mental health and psychosocial support by calming technique, relaxation technique, for example. So we are really cautious in the recommendations of the implementations of AI in the current stage. So the future direction with the support of this award is that I aim to examine how psychological and behavioral medicine can strengthen public health disaster preparedness by mitigating mental health challenges faced by healthcare workers during pandemic. And the theoretical frameworks that I will be working with, these qualitative studies, are job demand and resource, a framework that explains how characteristics of the work environment influence employee well-being and performance, and health belief theory, a social cognitive framework used to understand and predict health-related behavior, particularly in the context of preventive actions and disease management. So what I have presented, the data on the quantitative studies, we are looking from a very limited scope of question, but we are able to do the survey in large numbers of people. But from these qualitative studies, I will be able to go in depth to understand the situation more, to determine the crisis-related health behavior, to identify the psychological impact, and to explore the mitigating factors of these mental health outcomes among healthcare workers. All right, I also want to send my acknowledgements to my supervisor, Professor Adonina, Professor Pedro, as well as on behalf of the orchestra working group from the University of Bologna, Professor Paldo and team, from the Institute of Public Health of Romania, Dr. Dana and team, from the Institute of Public Health in Slovakia, Professor Eleonora and team, from UNITO, Professor Alessandro, as well as APHP Paris, Professor Javier. So that's all of my presentation today. I'll be happy to take your questions.
Thank you, Rick, for this presentation. You gave me a hard job to do, actually, to comment on this as an historian. Enrique just mentioned, with regard to the other paper, we heard that there are different approaches to topics within different disciplines. Your approach is a medical one, very interesting, and I really many aspects had already been out of my mind after the COVID pandemia. And now, with regard to your research, we are a bit back into at least the memories of the COVID pandemia. Nevertheless, as a historian, there's a whole set of questions which, well, at least as an historian, I would like to see in the final version of the project. We know quite a lot about pandemia within European history, starting with the plague, for instance, or cholera pandemia, or with regard to the 20th century, the Spanish flu, the Hong Kong flu, and finally COVID. What would interest me and what I would like to read in a paper from my point of view would be a comparison. How did the contemporaries, let's say, of the cholera pandemia of the late 19th century, of the Spanish flu after the end of the First World War, reacted to this challenge? What did they do? Did they think about further prevention? I know, for instance, from Hamburg, the Hamburg case, the cholera in the 1890s, that they improved the water system in Hamburg. There was an immediate reaction that clean drinking water was provided by the Council of the City of Hamburg to improve the situation for the citizens, that they don't have to drink infected water any longer. Yeah, the whole system of drainage within cities was changed. I'm not so much aware about the consequences of the Spanish flu. Actually, it's in the history of our memory. It is there as a brutal fact. The first real big pandemia just following the First World War. How did they react? What did they change afterwards to improve the situation? Another aspect which would interest me would be the choice of your groups. Why Romania? Why Slovakia? What is it representative to some reason, or is it just a coincidence because the people were there? Maybe you should think a bit further into this direction. Do we have representative case studies? Do we have cases which can be compared and which in the end, after the comparison, generate, well, results which are valid for longer periods? Yeah, and finally, what would also interest me is the European dimension of this project with regard to the topic of the seminar. Did the measures taken to cope with the COVID pandemia, did they improve European cohesion? And if so, to what extent and where? That's a question which should be tackled as well. I know you are working in the field of medicine, you know, but as a European citizen, I'm interested in aspects like this. I would like to get a, let's say, more complex, broader picture of this. So if you, I know, I mean, this is strong stuff for you again to tackle, but I would like to see your points, if you understand my position as an historian related to your field of research. Thank you.
Muchas gracias, Jürgen. Vamos a seguir, en este caso, el procedimiento pregunta-respuesta para que dé tiempo a racionar. No sé si quieres contestar. I don't know if you want to answer him before. Okay, and then we go to the questions from the public. Thank you. ¿Damos voz al micrófono de la mesa? Sí.
Testing? Okay. Yes. Thank you so much, Professor Everett, for the response. I have a quote that I heard that is, history often repeats itself. And for the case of pandemic, it is inevitable that pandemic is going to happen, but the question is when. But from the public health perspective, it is, are we prepared enough for when the next pandemic is going to come? And I am looking into the perspective of the mental health that has been shown again and again as a gap in the previous pandemic response. I think Professor has mentioned about some of the technological advancement from the perspective of the history, which is super interesting, about cholera and the drainage system. And I think we also living in the times of technological revolution, I would say, with the AI advancement. So I think also it's really important to put into this consideration on how AI could also help in the preparedness for the next pandemic. And a good question on why of the choice of the cohort. Yes, it is by coincidence that these countries are involved in these cohort studies on COVID. But I think also Slovakia giving a representation of the Central Eastern, Romania, Eastern Europe, and Spain, Southern Europe perspective. So in a way, it's quite comprehensive in a way, if I might say. Lastly, is did the measure improve European cohesion? As an outsider, I would say from my personal perspective, is absolutely yes. I have seen so much of the technological sharing between countries. I have seen so much of the data that has been presented in a different scientific conference to share what is the best practice to fight against this pandemic. And I think this is the time that we sit down and look backward on what we have done and to design on how can we prepare better for the next one, especially in the perspective of mental health.
Thank you, Dr. Kye. Let's go to the public and let's try to make as concrete as possible questions, and then we'll have answers and questions, okay? Thank you.
Yeah, Rick, my most sincere appreciation of your presentation and your research project, for your scientific rigor and for well explaining also your positionality in this research. I think it's really of added value. Really, what I appreciated in this whole presentation of the project was exactly this methodological rigor that you bring to the analysis, from the meta-studies for use of different kind of tools, examining different kind of aspects of this overall, let's say, problem that you're examining. So it was actually brilliant, and I also appreciated that you tied specific contribution and specific points of research you want to develop thanks to this grant. So I really appreciated that. This being said, I mean, the research is very, very interesting, and what is maybe something to consider is the broader applicability of the findings. So what I mean by this is that we have a lot of evidence on the first-line responders in disaster management, not only in relation to the pandemic. So, for instance, I wrote a book on dealing with terrorism. I did interview a lot of people who were first-line responders, so firefighters, medical personnel, etc., etc. So what this study evidenced is quite similar, actually, to what you point at in your analysis. And I also factor in different kind of characteristics of the first-line responders, such as age, which was quite important, gender was very important, and the prior existence of trauma. And what is maybe something to consider in your presentation is how do you actually isolate the impact that is COVID-related, yeah, from the health risks of everyday job. One last comment is maybe connects also with what JÜRGEN said on the EU dimension of the research paper. So maybe it could be something on the importance of the evidence-based practice and integration in the EU-level systems of resiliency building for communities and also for health practitioners. And this being said, also very, very, very quickly, when you examine the psychological impact and you speak about resilience of health practitioners, do you also factor in the use of rituals, which is quite important, because during the pandemic that you brought up in Bergamo, I was teaching in the Cattolica in Milano. So I visited a number of sites during the pandemics, and I could observe how the hospital personnel was creating spontaneous memorials in front of the hospital and engaging in this mourning and grief rituals, which was then later on said that is useful in reducing the stress levels, like helping them in a number of ways. So rituals maybe are one way of, observing this case as well. Thank you.
Thank you so much, Professor, for the recommendations. So back to some of your question, how do we isolate some of the psychological consequences, whether or not it is work related to work, is that we specify in the questionnaire really clearly that to ask them to recall the situation that is only related to the work. And it is also validated in some different countries and different language to make sure that this idea is clearly convey to the healthcare workers when they do the survey. So this is the way that we try to isolate them from the other traumas that they have been experiencing. And also in our cohort, we're looking into the healthcare workers that has been working since the COVID-19 pandemic started, so that this experience on their healthcare workers in the healthcare environments are related and in line with the pandemic that was ongoing. And related to your use of ritual, I think that is a really interesting aspect that we have to look into further. But in fact, one of the survey that we have done, mindfulness, is also have some background or histories that is related to the Eastern spiritual practice of mindfulness together with the yoga. As I live in Oviedo, I also see a lot of similarities with the Camino, for example, where the pilgrims or the people started to walk to understand their situation, take a step back from their life and to explore further to see how they could go about. And I think that's that kind of spirit brings in the questionnaire of the mindfulness, but to look it from the perspective of more scientifically and therapeutically as well from our findings, apparently. Yes. Well, thank you so much for the recommendation.
So thank you. I think there is more questions. The following one will be in Spanish, so I will give you just the interpretation, just in case you need it.
Thank you so much, Rick. I speak in Spanish, okay? Yo soy Kye Gan, profesora de la Universidad de Granada, del Departamento de Derecho Internacional Privado. Pues nada, Rick, en primer lugar quiero agradecerte por haber traído esta temática aquí, una temática tan necesaria, y voy en línea en lo que ha acotado a la profesora Ana. Es un trabajo que creo, desde mi perspectiva, puedo calificarlo un trabajo sólido, a nivel metodológico, brillante, sobre todo en derecho. Yo soy jurista, no solemos utilizar, somos mucho más teóricos, y esta base científica que tú le das, yo creo le da ese valor añadido, para mí importantísimo. Yo creo que traes un trabajo complejo, con una base ya sólida. Ya te han preguntado las cuestiones que me interesaban, por ejemplo, ¿por qué Armenia? ¿Por qué tal? O sea, o ¿por qué no incluir esa perspectiva más que nos interesa quizá aquí hablando de Europa, etcétera? Esas cosas sí hay que tenerlo en cuenta, ¿vale? Trabajas un tema que es invisibilizado, que es necesario abordar, pero es totalmente invisibilizado, como es la salud mental. Y precisamente en unas poblaciones, como en este caso estamos hablando de un grupo en concreto que son trabajadores médicos, o sea, dentro de un ámbito en concreto. Yo he trabajado esta temática con migrantes, sobre todo con venezolanos, por un proyecto en el que todavía formo parte, un proyecto Marie Curie europeo en el que estoy, donde trabajan el tema del bienestar, o sea, cómo el arte, en este caso el teatro, puede transformar la vida de los migrantes y reducir esos índices, por ejemplo, de ansiedad o estrés que tienen al llegar a determinados lugares. Y también he trabajado con presas y reclusas, cómo el deporte puede ayudar dentro de prisión a también reducir estos. Entonces es una temática que no lo suelo ver, y te agradezco por ello, porque es necesario. Estamos hablando de derecho a la vida, derecho a la integridad física, mental, relacionado igual a bienestar, que eso es al final lo más importante en el ser humano, ¿no? El estar bien, y más aún con personas, en este caso profesionales, que tratan a otras personas. O sea, importantísimo, muchas gracias. Lo que sí voy a tirar a mi ámbito del derecho jurídico, quizá yo he hecho en falta en esto un marco jurídico, es decir, es necesario para mí que se traiga quizá a la vez por niveles, por ejemplo a nivel internacional, qué instrumentos jurídicos contamos a nivel internacional, al marco de Naciones Unidas, quizá partir con el tema, hablar sobre todo del derecho a la salud mental. Para mí el enfoque de derechos humanos es como esa esencia o ese corazón de lo que tú estás haciendo, porque tú no puedes defender algo que tú no tienes recogido o contemplado en tu ordenamiento jurídico o ese país haya reconocido a nivel internacional. Entonces, esa perspectiva de los derechos humanos, ese enfoque, para mí es necesario, ese marco jurídico a nivel internacional, a nivel regional, europeo, y en este ámbito tendríamos que ver Consejo de Europa, Unión Europea por otro lado, Convención Europea, esos instrumentos jurídicos de protección de este derecho a la salud mental y luego ya incluso llevarlo en un tercer nivel en el ámbito estatal, es decir, a un país o países en concretos, cómo regula, cómo recoge. Entonces, para mí eso sí es necesario, porque para defender algo, para tú decir se está violando esto o aquello, tiene que estar contemplado al menos en algún instrumento, aunque sea declarativo, pero tiene que estar recogido ese derecho tan importante que es a la salud mental. Ya está, muchísimas gracias, Rick. Thank you so much.
So, go ahead, please.
Testing. Thank you so much, Professor, for your recommendations, and absolutely I will take it into the consideration. And I also want to bring you to one of our studies that look into effort-reward imbalance to find the effort that the healthcare worker put into their work as well as the reward that they're receiving and how they perceive it, whether or not in balance. I think from that perspective, I could also look into what you recommend from the legal perspective. For example, how could we improve this condition? For example, long COVID was not recognized before because it's such a new syndrome that disappeared, and now it should be taken into the considerations, and maybe some sort of protection should be given to the healthcare workers who are suffering from it. I absolutely agree, and I also really agree on the mental health perspective, and I am also, sorry. I'm also really happy to listen from you for the good work that you have done. And I think it is, public health is like a history. We learn as we go. And from this pandemic, we know that it is late when the mental health was prioritized. And I hope that the work that I'm doing now could make us more prepared to the next pandemic from the perspective of mental health. Thank you.
Okay. En español? In Spanish? Okay, right. Enhorabuena por esa presentación, bueno, que sale del ordinario para un público como el nuestro. Pero aún así podemos, como juristas o politólogos, podemos sacar algunos elementos. Y aquí quisiera saber si has contemplado o si prevés contemplar la dimensión cultural, pero la dimensión cultural no me refiero a los artes o lo que sea, sino a la cultura médica. Quiero decir que con la aproximación de una situación pandémica, pues efectivamente muchos, no solo gobernantes, estados, sino también las poblaciones, no estábamos, por lo menos en Europa, acostumbrados o preparados a un fenómeno de tal magnitud. Podría ser un terremoto, podría ser otro desastre climático o cualquier fenómeno. No estábamos y no estamos, y no creo que aún no estamos preparados a esto, porque el ser humano, a nivel individual como a nivel colectivo, tiene un pequeño defecto: la memoria. Nos olvidamos rápidamente, ¿no? ¿Quién se acuerda realmente? Nos acordamos todos del confinamiento, de los 3 meses. Pero aparte de esto, bueno, y sí, unas imágenes dramáticas. Voy, cortan. Vale. No, porque estás aquí, estás mirándome, tengo la sensación de que hacerlo más corto. Bueno, entonces, en los países donde pues, has trabajado, analizado, ¿hay o no hay diferencias de la cultura médica? ¿Se aproxima la cuestión o se ha acercado la cuestión pandémica de la misma manera desde el enfoque médico? Y la segunda pregunta es, bueno, a partir de si hay diferencias, esas diferencias se han trasladado a lo que podríamos llamar las normas, no en términos jurídicos, pero o los estándares, los protocolos médicos. En definitiva, ¿cuál es el impacto o el impacto de la dimensión cultural en la gestión de una crisis de este tipo y en el aprendizaje a actuar frente a una futura pandemia o un futuro desastre. Gracias.
Testing. Thank you, Professor, for your question. I mean, culture is one of the really important perspectives, especially when we talk about European Union is a collective of different countries and hence different cultures are expected. We have been really careful with the cultural dimension, especially when we are doing this survey, and we are really lucky that we also have the experts, the public health expert, occupational physician expert from each of the countries who are there to make sure that all the survey that we have done was validated and to look into the cultural as appropriations as part of the indicators. And you are right, even in the local aspect, if you look into two different clinics in the same town, they have their own cultures of working different things, but all of them have the same outcome, which is to receive their health. And therefore, in our scientific studies, we are looking into what are the outcomes that, for example, what are the psychological consequences that has been experienced in the healthcare workers of the different countries, and what are the behavioral construct determinants in general, so that we can use that to design, which is local and cultural specifics. But with that findings that we have, it is an evidence-based and scientifically based methodology, but it can be, sort of combined with the local aspects of the cultures when giving the recommendations into the local situation. So I think that is a really good question, and I hope I answered it.
Good morning. I'm Rocío from the University Carlos III of Madrid. First, I would like to congratulate you, Greg. Your study, your methods, your passion and ethics are absolutely inspiring for us. From a very, very different research study line, I really appreciate your valuable and necessary study. I cannot comment anything about methods or results because from the outside are absolutely outstanding, but while you were presenting and after some of the comments, I was thinking if you have considered to include maybe as a contextual or introductory section what the EU has done to support mental health of the health professional after the pandemic. Maybe it could help you to link your research to the European scope of this seminar that's being mentioned. Thank you.
Thank you so much for the recommendation. I will absolutely include that perspective. Thank you, Rocio.
Hello. Hi, Rick. It's Gabriel here behind from Universidad Politécnica de Madrid. Okay. So thank you for your presentation. It's been very inspiring, as my colleague just mentioned. And I was wondering, as well, you know that my background is from architecture, so I was wondering if within the questionnaires you make to the users and to this people involved in the big healthcare system, if there's a way of identifying, is there any space for spatial dynamics within the mindfulness that you're trying to address? Because, for instance, I was trying to picture all of these dynamics, of the stress that you were commenting. Is it maybe related at some point to the spaces where these activities take place? So I was wondering, but this is just maybe for curiosity, not to open another scope within your already amazing research. But I was wondering if you think that there could be space, mental and physical space, to address how the spaces can help us in mindfulness, or maybe in the opposite way. But yeah, we can also discuss this in lunch.
Oh, I mean, that is a really interesting perspective to take into consideration. But the fact that mindfulness is something that can be practiced, it can be found innately more in some people and less in some people. But it is also something that can be taught and something that can be practiced. It's something that means that it can be disseminated among the healthcare workers to reduce the impacts of the COVID. And space, yes, that is a really important thing because some people have a different way of, finding their peace of mind, to be mindful. Some people would like to have a space, personal space. Some people would like to share, which unfortunately during COVID is not available. But you have brought out a really interesting point of view to look further from the perspective of mindfulness. Thank you, Gabriel.
Hi, here Ignacio Fornaris from the University of Bologna and CEU San Pablo of Madrid. Thank you so much for your inspiring presentation. I can only declare myself fan of you and your work. And I wanted to ask you whether you consider the mental health situation of the physicians prior to COVID pandemia. For instance, these last weeks we had in Spain nationwide protest, although this was overshadowed by all these political scandals. But basically they were asking for better conditions. They are suffering extended on-call duties, the sleep deprivation, and so on. So do you think that these long-standing issues has any impact on these mental health issues and crises?
Thank you, Ignacio. I think that is an extremely good question. In fact, I look at this situation as a tip of a glacier. So before pandemic, we have already seen actually some of the complaints that there's a lack of healthcare workers personnel, there's a need of an improvement of the system, the equipment. But what pandemic does is that it provides enough stress to reveal the rest of the glacier. All the problem is now on the table, surface. And I think it is an ongoing sort of problems that need to be addressed, but pandemic sort of emphasize it in a way. And I also think that we need to capitalize these moments to tackle the problems to make sure that in the next pandemic it won't happen again. Yeah, good question. Thank you.
Thank you very much. More comments from the public? We still have a few minutes left. Maybe I will give the floor to Professor Elbert if you want some final remarks before we are closing, also commenting on the comments from the college.
Well, I think my impression also with regards to the questions asked here and to the comments is simply to encourage you to broaden the perspective a bit. Yeah, I mean, it's the methodology is spotless, no doubt, but if you want to create, let's say, an echo on your research beside the sheer healthcare sphere, the results should address a broader public. Yeah? And this can be steered by additional information, by the involvement of other disciplines, outcomes of other disciplines into the project. I mean, you don't have to make it yourself. I mean, you're working on the field of medical aspects, but you should invite experts from other disciplines to answer certain questions related to this project. Yeah, and what is absolutely necessary is the European perspective. Yeah, and the comparison within Europe, maybe your test groups should be broadened a bit as well. You can, of course, rely on certain groups which are there by coincidence, but to think a bit more about comparable test groups and to take them into account would even further improve your research. Thanks. His last words? Not yet.
Well, thank you so much, everyone, for your time and attention.
Muchas gracias, doctor. Muchas gracias, doctor Kye. Muchas gracias al profesor Elbert por acompañarle en este trabajo. Seguirá acompañándote una vez que entregues el papel final, porque los presidentes de mesa también se encargarán de revisar vuestros trabajos. esta ha sido la primera parte del seminario doctoral. Agradeceros también el respeto de los tiempos, que creo que es bastante importante y nos permitirá disfrutar unos minutos más de la comida y relajarnos, sobre todo porque el calor empieza a apretar. Así que muchas gracias a todos y bajamos a la comida. El autobús estará en unos minutos, con lo cual tranquilamente podéis dejar las cosas aquí, no hay ningún problema. Y bajamos a la comida, vamos a comer en un restaurante aquí en Cuacos de Yuste, ¿vale? Venga, muchas gracias a todos. Gracias.